Chambers are best known for treating decompression sickness from scuba diving accidents, but they also may be life and limb savers for patients whose severe wounds simply won't heal. That's what research at Presbyterian Hospital in Dallas is seeking to learn. As we check in on medical advances, we hear about this first-of-its-kind study from KERA 90.1 reporter Bill Ziebel.
This study looks at diabetic patients with severe foot wounds. Diabetics account for half the nation's non-traumatic amputations every year, costing $500 million. The problem is magnified in Texas because the disease hits Hispanics and African Americans far more than Anglos. The director of this study at Presbyterian Hospital's Hyperbaric Medical Unit says the personal cost cannot be gauged.
Diabetes is such a terrible disease that 50% of all non-traumatic amputations in this country are due to diabetes. So we're looking at 50 to 60,000 amputations a year. 3- and 5-year survival rates for patients that have amputation are dismal at 40 and 50%.
Stone's patients here have either lost limbs or risk losing them. And for every year after an amputation, there's a 10% greater chance of losing another limb. Statistically, they also walk a step closer to death. Ruthie Clark's been insulin dependent for 5 years.
I stepped on a tack, is what I had stepped on, and got a tetanus shot immediately, and with the diabetes it just made an ulcer, and I got strep infection in my legs, and some other infections, and they had to go in and cut the bone out of the heel and remove the infection out of my foot. And there was a chance then that my foot might be cut off.
So Clark and others are perfect for this study. Inside the 40-foot-long, 68,000-pound chamber, she and other patients dive to 45 feet below sea level, in a manner of speaking. Actually, the pressure increases, raising the amount of oxygen in their bloodstream. In addition, some study patients will breathe pure oxygen, giving them 10 to 15 times more than usual. For years, it's been known extra oxygen generally helps hard-to-heal wounds. Up to 90% of those who get treatment avoid amputation, compared to about 50% of those who don't. But this is the first study ever to test it in advance using a double-blind study. That means doctors won't know exactly who is getting pure oxygen. Neither will patients like Audrey Markell. One of her toes was recently amputated, and the doctors are trying to save the others. She knows she may not be getting pure oxygen, but she used to be a nurse, understands scientific procedure, and agreed to be part of this study.
You know, in the United States, they just don't let you say anything or do anything without you proving it. So that's pretty far. But they said they really know that deep down, you know, the chamber helps wounds heal.
Markell, the willing guinea pig, says she's improving. Sensation in her foot is increased, and the wound is looking better.
The nerves are back, you know, in my foot, and I have feelings, and it's nice and pink. The foot is nice and pink, so that means a lot.
It means a lot to Dr. Stone, too. Getting better is the top priority. If patients don't improve after a week or so, they're pulled from the study and chalked up as an experimental failure. If they weren't actually receiving pure oxygen, they can re-enter treatment, so they do. When this experiment is finally over, Stone hopes the results will once again prove the effectiveness of hyperbaric oxygen as an additional therapy for amputation candidates.
Every night I pray that this person that's healing is getting the hyperbarics. Because again, I'm very biased, and I really do feel that hyperbarics plays a role, but that we need to better define that role. Again, I don't know what these patients are getting, so I'll just have to wait and see, along with everybody else, what the study shows down the road.